So Kevin Durant had a second injury tonight in the game, Toronto versus the Golden State Warriors, where he was dribbling the ball and had, looks like an injury to his right ankle. In this video today, I'm going to be talking about Kevin Durant's injury, what type of injury I think it is from an orthopedic surgeon standpoint, and what is the most likely outcome of this and what should be done about it. What's up, everyone? This is Dr. Webb. I'm a fifth-year orthopedic surgery resident, and in this video today, I'm going to be talking about Kevin Durant's recent ankle injury. In Game 5 of the series between the Toronto Raptors and the Golden State Warriors, Kevin Durant injured his right ankle. For the last 30 or so plus days, Kevin Durant has been out with reportedly a calf injury to his right calf. And in this game today, he reportedly hurt his ankle. If you look back at the last game that he was playing, he actually grabbed his calf. But in this game, he actually grabbed his ankle when he was dribbling the ball, tried to go for a particular move, and had immediate pain in his right ankle. So what can this injury possibly be? The report states that he has an ankle injury. There is nothing out there that in terms of what it could be, but most likely the injury is to his Achilles tendon. The Achilles tendon is actually the longest tendon in the body. It is a confluence of different muscles, the calf muscles that attach to the heel bone or the calcaneus. And you can have an injury to your Achilles when there is a sudden we call it eccentric movement to the foot. When this happens, it usually occurs in the hypervascular zone, which is an area of the Achilles tendon that does not really get blood supply. It's usually 4 to 6 centimeters above the Achilles insertion, or where the Achilles inserts at the calcaneus or the heel bone, and you have a rupture there. Usually when there's a rupture there, you can feel a palpable defect or a little absence of tendon in that area, or sometimes you may not be able to feel that. Patients usually report a pop and then some weakness and difficulty walking. Usually on examination, the way we diagnosis is with there's clinical diagnosis, and also there's diagnosis with imaging. Clinical diagnosis, we use what's called a Thompson's test. Basically, place the patient on their stomach or the prone position. We squeeze their calf, and then their foot should plantar flex, or it should kick down. This is indicative of an intact Achilles tendon. When there is a rupture of the Achilles tendon, you lose this plantar flexion of your foot, and then it's called a positive Thompson's test. Usually you can get an ultrasound, or in this case, MRI is going to be performed tomorrow, looking at the Achilles tendon and see if there's an injury or a rupture there. If there is a rupture there, as orthopedic surgeons, there's lots of different studies out there comparing operative treatment versus non-operative treatment. But in general, for a high-level athlete who wants to get back out there and play for additional amounts of years and time, the treatment is usually surgical. And the way we treat this is making a small incision on the back portion of the ankle, going down to the Achilles tendon, and then putting some sutures into the tendon edges to approximate the tendons so that they heal in that particular position. There's a nerve in that particular area called the sural nerve that can be injured during this operation. There's also ways of doing this percutaneous, which means smaller incisions instead of the large kind of open incision on the posterior aspect of your ankle. If it is an Achilles injury, the recovery is a long one. It could be up to 6 to 9 months, or sometimes even longer. There's also a question about whether Kevin Durant should have even played this game due to his recent injury. Was he ready to come back at this time? Did he overdo it, trying to get back into the game too soon? But who knows? So the next step would be an MRI. Depending on what the MRI shows will dictate what happens next, whether it's surgery or whether it's just an ankle sprain, which is basically injuring the ligament on the lateral aspect of your knee. If that is the case, you can be treated with physical therapy and some RICE therapy, is basically rest, ice, compression, and elevation. So depending on what the MRI shows will dictate what happens next. But I imagine we won't see Kevin Durant playing any more of this series if he goes past Game 5. This is Dr. Webb. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.